Hello, good evening. And as such, technically, welcome to the last session of this lower limb, right? Because tomorrow you'll be having exam. Great. Yes, good evening. Now, see what I was thinking that, see, as such, today's session is bit small, right? Because there are only few vessels and few nerves. So what we do is we pick up our journey from heart all the way till the lower limb, that the vessels of the foot, right? So that way we'll be having a very clear concept that what exactly we'll be dealing from all the way heart to the soul. Plus we'll be talking bit about obturator artery, right? Bit about obturator artery, bit about internal iliac artery, because they are very important in abdomen, right? And yes, as the question has been asked, we'll be starting abdomen from Monday, right? So let's begin. Okay. Uh, so I hope you can see me properly, right? Now see, instead of making a separate file, what I have done is I have left few blank pages. So this is what we'll be discussing today. And here is what we write, right, from here. So that you'll be having just one PDF and in which everything is there, including those soul suppliers, that is nerves and vessels of the soul, plus our this journey. Yes, clinical part. I'm not only the clinical. In fact, I'm planning to take one radiology also. That is the sectional imaging. But just give me few days because there are so many images. So I need to compile. I tried to do that, but it would take some time. So meantime, we'll start the abdomen, right? Don't worry. And in between, I think on any of the Sunday, will take this clinical part of lower limb, right? But be assured, I'll definitely take it along with the radiology also, so that the sectional imaging. So it won't be like, say, for example, if we are talking about that medial circumflex femoral artery is very important, because in case if there is any fracture of neck of femur, then it may lead to avascular necrosis of head of femur, right? Now, instead of just telling this, I'll actually show you the X-ray of avascular necrosis regarding how to diagnose it. So that way, things would be much better, right? It will be much clearer. So I'm compiling it, right? So, but definitely will be doing it. Okay, sure, no doubt about it. But do prepare well, right, for tomorrow. Yes, the question was asked that will we be having test today? Not today. We'll be having it tomorrow, right? Okay, so let's start. We start with, because here is what where we'll be ending. So I'm starting from this point. Okay, so here is the heart, right? In heart, say that's the left ventricle, right? From left ventricle there would be aorta, right? And then it would be like a thoracic aorta, then it will go into the abdomen, so there will be abdominal aorta, and this abdominal aorta will be dividing into two parts, right? And that would be right and the left common iliac artery. I tell you, when I used to study, I used to follow this practice. Now, actually, it gives you tremendous advantage, right? The entire picture becomes so clear, and say how we go for it. And then this common iliac divides. It divides into external iliac, right? And internal iliac. Now, as all are arteries, so we'll stop writing arteries, right? External iliac and internal iliac. Now, this internal iliac, it is also called as the hypogastric artery, right? Hypogastric, okay, I have written hypogastric artery. What is the nerve fiber? L1, S2, yeah. Okay, we'll talk about the nerves later on, right? Right now, otherwise it will break the whole leg. So right now, let's focus only on the arteries. Okay, so internal iliac, right? Now this internal iliac is very important. It's not very important at this point of time into the lower limb, but yes, it will be playing a major role when we'll be dealing with the abdomen, right? So let's talk bit about it. So there are in internal iliac, there is anterior branch and the posterior branch, correct? Posterior branch. We'll talk about posterior branch, but let's see about anterior branch first. Now, this is something which we have not talked much. We have just talked a portion of it, and that was like obturator and inferior gluteal. But if we try to see the whole picture, right, it is divided into vesicle, right? One is what is vesicle branch. Second is the visceral branch. And then the third is what is called as the parietal branches. Now, when we say vesicle, once again, it would divide into superior umbilical and inferior vesicle, right? So, like say superior vesicle, then umbilical and inferior vesicle. And when we say vesicle, that means urinary bladder, right? So this is what it will supply. This superior vesicle will supply upper part of urinary bladder. Inferior vesicle will supply inferior part of urinary bladder. So this is just for the sake of completeness. We'll follow the same practice, exactly the same practice when we'll be doing the abdomen, right? So at that point, when we'll be talking about abdominal aorta, right, we'll follow this entire pattern. So that way, we'll even do it for upper limb also, right? So all those points all those points I have written on a separate piece of paper. So one would be the clinical part, radiological part of lower limb, then this entire the journey from heart to heart, right? So that will go for upper limb also, abdominal obviously. For this visceral part, right, these are the vaginal and the uterine arteries, right? Obviously, they are the part of abdomen, right? Abdopelvis. It is the parietal branches which we are concerned with, and one of them is obturator, right? We talked about obturator, and then there would be, say, internal pudendal, very important branch. But again, it is dealing with the pelvic organs, so internal pudendal artery, and the last one is the inferior gluteal artery, correct? Inferior gluteal artery. Still, we change the color so that things become uncomplicated, because it is like obturator. Now this obturator will divide into two parts, right? This is anterior branch and the posterior branch. And as you'll be having this PDF, right, I'll suggest you that what you do is, once you understand the whole thing, try to rewrite everything without watching it, right? And then you'll be having super clarity, right? You'll be very happy with yourself. Meantime, yeah, vaginal will be present in men also, or there'll be no, they won't be present. They won't be present, right? In fact, it is like, we'll see it in more detail because it is the inferior vesical artery, right? Sometimes it is given the other name also. So it is like, definitely those vaginal and uterine arteries, they won't be present. Okay. Now, what we were talking about, I was telling that just put a star mark on inferior gluteal artery. We'll come to that, right? So because we have to carry this inferior gluteal artery in further in our discussion, right? Okay. So where were we? Yeah, here. Anterior branch, right? So this is like anterior branch of obturator, right? So don't get lost, right? I'll keep on shuffling up and down so that you know that where exactly we are talking about. Just to be clear, we are just dealing with internal iliac. We have not yet touched external iliac, right? In fact, it is the external iliac which is the larger one. Then it will go all the way to the femoral and this and that, popliteal and right all the way anterior tibial, posterior tibial and making the arch, etc. Right now, we have not touched it. We'll come to that soon. Okay, so here is the obturator, right? Anterior branch. It is this anterior branch. So moving on to the next page, right? It is this anterior branch which will be supplying all those muscles, obviously, which are near to it. So it is pectineus, then obturator externus, then adductors and the gracilis, right? So adductors and the gracilis, right? Sorry. Now comes something very interesting. It goes for the anastomosis, right? It goes for the anastomosis. Now this anastomosis is with whom? Well, it is this with posterior branch, right? It is with posterior branch. Now this branch is smaller, right? You remember when we were dealing with I think the hip region, right? So at that point we said that this posterior branch as such, it has to come to this anterior branch, right? And this also anastomose with medial circumflex femoral artery. So done. Obturator part is done. Clear? Now we talk about that posterior branch, right? See, here it is, the posterior branch. Anastomosis is like when one artery joins with another artery. They are also called as the circulatory anastomosis. It means in case if one artery fails, there is another artery which will supply to that region. Okay, all right. So here we are. We change the color. This is posterior branch of internal iliac. So all the way we take this posterior branch, right, all the way, right, all the way down, right, that's like here is and here it is. Yeah, these are digital pages, that's why we can use them lavishly. Otherwise we would on paper, so we would have cut so many trees. Okay, so here is the posterior branch of internal iliac. Yeah, there are two anastomosis. That's right. That's right. Okay. So this internal iliac, again, we have not talked much about it, right? When we'll be dealing with abdomen, at that point, when we'll be talking about iliosacral joint or the sacroiliac joint, at that time, we'll be talking in more detail about these two branches. One is, the names are easy, iliolumbar, right? Iliolumbar, the name itself is telling that what exactly are we talking about. So iliolumbar artery, and then there is one more artery, it is a lateral sacral artery. So these will be our candidates for discussion when we'll be talking about the pelvic region. Meantime, changing the color. Superior gluteal artery. Superior gluteal artery. And I ask one question, right? I'm putting a star over here also. There was one very fine muscle, right? There was one very smart muscle above was superior gluteal artery, and below was inferior gluteal artery, right? which muscle are we talking about? Which is this muscle? Right? Which muscle are we talking about? There was one muscle which was lying very smartly between these two. Above was superior gluteal, below was inferior gluteal. Which muscle are we talking about? Which muscle? Yeah, I'm watching your answers. Which muscle are we talking about? Very good. Very good. It is piriformis. Obturator internus nahi. No. Not obturator internus, right? It is piriformis. We have seen this thing in both the ways. We have seen it in the form of image, and we have seen in the form of the dissection also. Just go back to those videos, right? And you'll have a very good idea about it. In fact, you can just go through the PDFs also, right? So this is piriformis. That's right. It is the piriformis. Right? Very smart muscle. Okay. So done, right? The internal iliac part is done. Now we move on to our external iliac C, right? So internal iliac done, anterior branch, posterior branch, visceral, vesicle, parietal, obturator internus, obturator artery, anterior branch, posterior branch, anastomosis done, and then the posterior branch interior iliac, and that is the superior gluteal, and it's all over. Okay, so here is, now we start with our external iliac. This will be our main artery. All right. I think we should be running short of pages. No problems. We'll add more. So here is external iliac artery. Right. This is large. Surely large. Now this external iliac, as it will cross that inguinal ligament, right? You remember? As it crosses that inguinal ligament, an inguinal ligament which was forming the base of femoral triangle, right? So here there would be the femoral triangle, and then as it crosses this inguinal ligament, its name changes. So we change the color, right? It will now be called as the femoral artery. Femoral artery. Now, okay, this femoral artery, right? This location itself is very important, very interesting, because a very adventurous thing, and that is what is called as the coronary angiography. Coronary angiography, right? That is done from here. So a catheter is put into the femoral artery, and then all the way you go up external iliac, from there common iliac, then travel all the way up, and then enter into the coronary, and then inject the dye, take the shots, right? And then you see the entire coronary circulation. So that's why this place is very, very important, right? That is the femoral artery. Okay. Now, meantime, one artery comes out of it, right? It gives a branch, and it's a big one. So, and it is a deeper one. So, profunda, it is profunda femoris, right? Profunda femoris. And it is also called as the deep femoral artery, right? It is also called as deep femoral artery. Now, this deep femoral artery, or the profunda femoris, what it will do? Well, it's okay. It will be giving those perforating branches to adductor magnus, right? 1, 2, 3, 4, right? Big muscle, so rich supply. So he enjoys that lavish blood supply from all these perforating branches. And we can just write adductor magnus. So this gives us the clue, right? You remember in all those images, in all those images, right, there were like the artery going, and then 1, 2, 3, 4, right? All those branches, they were going into the muscle. Right now we are not touching femoral artery, right? We'll come back to femoral artery. because once femoral will start, right, then there is no end to it because it will take all the way up to the sole. Okay, so perforating branches, what else? Two important arteries. They are lateral and the medial, right? Circumflex, okay, let me write full, no problem. Circumflex femoral artery. Now this lateral circumflex would once again divide into that ascending, transverse and descending, right? And this medial circumflex femoral artery. This is very important, so I'll highlight it. I'll highlight it just for one reason. I just talked about it, right? When we started, that this medial circumflex femoral artery, as it winds around the neck of the femur, right? And one of its branch, it goes to the femur head. So when there is fracture of, say, femur neck, fracture of the neck of femur, and in case if this artery is damaged, right, what would happen is it would affect blood supply of the head of the femur, right, and that will lead to AVN, or the avascular necrosis of femur head, right? Very, very important. Correct. Perforating branches means they will be perforating adductor magnus, right? And they'll be entering and supplying it. Okay, so do remember this medial circumflex femoral artery. And you know, this was the reason for this anastomosis. See, now you know it. But in case if anything goes wrong to it, right, one of there might be another branch which will be at least supplying the head of femur so that there is no avascular necrosis. So that's why that rich anastomosis plays important role. Okay. So let's pick up now our prime artery, that is femoral, right? This is femoral. So here it is, again taking that yellow color, and here is here, right? That's our femoral artery. Now we are comfortable because now we have to deal with just one artery. So this femoral artery, as it is going, right, where it will go into that is, see, right now it is in femoral triangle, right? Femoral triangle. And say this is femoral triangle, right? Then from femoral triangle till that adductor hiatus, right? This is the area what is called as the adductor. That's right, right? So then, from the apex of femoral triangle to adductor hiatus, right? So this is like femoral triangle, and this is adductor hiatus, right? Adductor hiatus. In between, that is what it is, adductor canal, right? So this is adductor canal. Another name of adductor canal was Hunter's canal, right? Hunter's canal, right? There is nothing like Shikar. It is just the name of that person, right? Name of the anatomist who first gave the name, right? So that's why. Okay. So meantime, this adductor canal, if we see, so how is it situated, right? Over here, there is vastus medialis, there is adductor magnus, and on top of it, that is on the roof, we do have one muscle, and yes, that angular muscle, it is none other than sartorius. Correct. So on the lateral aspect, so this would be of the lateral aspect. On the lateral aspect, there is vastus medialis, right? Then the adductor magnus, that's the groove which is in between. Adductor magnus will be in the floor also. And then on top of it, that is on the roof, there is sartorius. And in between, gracefully, it is this femoral artery is passing. Okay. Now femoral artery has reached to what level? Femoral artery has reached to adductor hiatus, right? So it has reached to adductor hiatus, and adductor hiatus was the gateway where from anterior things would be going into the posterior region. So here it is now the posterior part, right? So now we are into the, say, popliteal fossa, correct? Right, back of the knee. From here, we'll start calling this as popliteal artery, right? It is just nothing, same continuation of femoral, but because it is now in the back, popliteal. From here, it will divide, tuck, tuck, right? One anterior tibial artery. You know, when I used to learn this, I thought that this bichare anterior tibial artery, how frustrated she must be. Because she must be thinking just before few inches, right, I was in anterior compartment, and now once again I have to pierce that interosseous membrane and again go into the anterior compartment. So why I was not sent directly, right? Only God knows the answer. But I used to really sympathize with anterior tibial artery, that just before few inches, right, she was, the artery was anterior, and so why it has come posteriorly, right? To give some branches to the knee. Okay, so here it is via interosseous membrane, right? Interosseous membrane, and now it goes into the anterior compartment, right? I hope you know all the muscles of anterior compartment, right? Tibialis anterior plus 3 more, right? I know you know it. Okay, so that's anterior tibial artery. Journey is not complete, right? Anterior tibial will still continue. Meantime, this popliteal, right, it will be giving, right, it will be dividing into the posterior tibial artery, right? Posterior tibial artery and the peroneal artery. Now we are so comfortable with those nomenclature that this peroneal, that means it will be lateral, right? And it gives all those perforating arteries, right, to those muscles. So perforating arteries. Posterior tibial, yes, surely it will be going into the posterior compartment. So again, my question would be same. You must know the muscles of posterior compartment, right? Thank you, thank you. So posterior compartment, right? So I'll just give posterior, tibial is posterior, right? Tibial is posterior plus 3 more. And as I said, that there is such a nice musical thing between anterior compartment and posterior compartment, right? I hope you remember that. And definitely I'll be asking this question in exam, right? Okay. So here is anterior compartment, right? Now, all the way from anterior compartment, there is not much of the things happening. This anterior tibial, all the way it will go, right? It will reach at ankle, and then there is extensor retinaculum, correct? And as soon as it crosses it, name changes, right? So we change the color. It is now called as the Dorsalis pedis. Now, as I'll be showing you all these vessels, right, in the real dissection, because today it is like almost everywhere the real dissection is what we'll be watching. So we'll be discussing something more also in that, right? But this is for complete clarity that what exactly or where exactly are we standing when we talk about dorsalis pedis, or we talk about that, okay, it is the deep plantar arch, or when we say it is the lateral plantar artery, which is the branch of posterior, right? So that way we should be properly oriented. That's the purpose of this entire thing. Okay, so let's keep the dorsalis pedis artery as it is right now, because it has to do something with the other one. So here it is in the posterior compartment, right? Now, when this reaches at ankle, right? At ankle, it divides, right? It divides into medial plantar artery, right? And we'll see that this medial plantar artery is a small one, but we'll see that, right? We'll see that it anastomosis, right? And it supplies all those muscles which are near to it. We'll see all these things into our dissection. But things which I really want to explain is that it is the lateral plantar artery. Lateral plantar artery. Lateral plantar artery, right? It forms deep plantar arch. Deep plantar arch. But then it requires, and lateral plantar artery, it really say communicates with this dorsalis pedis. It communicates with dorsalis pedis, right? And that's where this is now called as the deep plantar artery, right? Very simple name, because dorsalis pedis is quite superficial. And here, when we are talking about lateral plantar, so then lateral plantar is on the sole, right? Yes. So then this dorsalis pedis, it creates a stunt, right? It tells that yes, I'll go all the way deep, right? It dives deep to meet this deep plantar arch, and that's how the entire arch is complete. So that's why its name is very logically given to deep plantar arch. Then no problem. Otherwise, deep plantar means this dorsalis pedis will say, okay, that's my duty. So I'll go with all those superficial, right? Superficial supplies, right? It will keep on doing those superficial supply. Meantime, that deep plantar arch, it will say that that was my purpose, and it will come over here, and then it will divide very happily, and will give supply to all the digits, right? So that's how things go, right? We'll follow the same practice, right? Even in abdomen, because in abdomen so it would be so nice, because there'll be liver, so there'll be hepatic circulation, that would be the separate. Then there'll be all those vessels which will be supplying, say, organs, right? Then there'll be separate for pelvis, right? So it will be a very interesting thing. Okay, yeah. Antitbl artery, right? That is the dorsalis pedis. That's right. Because anterior, name itself is, right? You don't have to even remember it. Anterior means it is the dorsal part. And as it crosses extensor retinaculum, again anteriorly. And then as it crosses, we change the name. That is dorsalis pedis. In fact, dorsalis pedis is continuation of antitibial only, right? Okay. Now we go back to our, so we were successfully be able to complete that. Just one page was left out. Okay. So let's go to this, our, yeah, all right. So about the sole suppliers. And yes, we'll be talking about sural nerve also, right? Because it is a small nerve, sural nerve, and even the saphenous nerve. That is what, so that for the total completeness of the topic. So here is our lateral side, right? So that this is a lateral side. I'll keep on writing for proper orientation. So that's a lateral malleolus, and this vein, It has to be short saphenous, correct? It has to be short saphenous. I might ask this question, right, putting this figure, that which vein is this, right, short or long? Remember, long is on the medial side. Okay. And how is it this formed? All these superficial veins, right? All these superficial veins, right? All these superficial veins, they gracefully join together to form this short saphenous vein. And yeah, this one is the medial side, right? That's the medial side. And we do have the long saphenous, right? That's long saphenous vein. Okay. Now, as we come to the ankle, right? So remember, this is front, right? This is front. Oh, how can we really say so? Just this extensor retinaculum. Look at its shape. That is helping us that this is front, right? So that's extensor retinaculum. In extensor retinaculum, just underneath is all those big muscles, right? So this one, and this one, you should be able to identify them without any problem, right? These are the muscles of those anterior compartment. So in anterior compartment, we talked about that there is tibialis anterior, right? Which other muscles? Extensor hallucis longus, extensor digitorum longus, correct? So here it is, right? See, such a big muscle, right? Their tendons, they are coming over here, and this is extensor hallucis longus, right? We are dealing with the right side, right? This is the right side. So that's why here will be the big toe, right? Okay. So that is extensor hallucis longus, and this will be extensor digitorum longus. Done? Okay. By the way, only one more muscle is left out, right? And it is this muscle, which was that chota sa muscle, right? We can see him over here, right? It is there, right? That would be the question of exam, right? I'll say, okay, I'll tell, right? And you know that also. Which muscle we are talking about? Which was that chota sa muscle, Bechara, who was isolated from the lateral compartment, right? They are big brothers, they are sitting over here. Which muscle are we talking about? Varicose means you are talking about varicose veins. I think varicose veins. You are talking about varicose veins. This part we'll take in clinical, right? Don't worry. We'll take it in clinical. Okay. So meantime, this muscle. So, okay, I got it. So which this muscle, right? As such, it's a third muscle, but over here it's a fourth muscle. Arey, extensor digitorum brevis. Why? Extensor digitorum brevis. I'm telling the muscle of anterior compartment. That's right, right? It cannot be extensor digitorum brevis, because digitorum brevis means chota muscle, small muscle. Small muscles, they emerge from sole, they die in sole, right? They are the muscles of foot only, so they don't cross. That's the reason. One important thing what I talked about is that extensor hallucis longus and the extensor digitorum longus, they can perform one movement which extensor hallucis brevis and extensor digitorum brevis cannot. Which movement are we talking about? Right? I repeat, flexor hallucis. See. I'm asking the question again. Which movement are we talking about which can be performed by extensor hallucis longus and extensor digitorum longus collectively, and hallucis brevis and digitorum brevis cannot? Which movement are we talking about? It's not a very difficult question. This is the movement which occurs at ankle joint because they are long, they are coming all the way from the top. So what happens when they contract? What happens when they contract? So dorsal flexion or the dorsiflexion. That's right. Because see, external hallucis brevis, right? He'll be doing just extension of big toe. Yeah, that's very good, right? Good. So, right, extension of just big toe. Those digitorum brevis, right? They will be doing extension of fingers, but they can't do the dorsiflexion, right? Because for dorsiflexion, someone has to pull the things from the up. Very good. So you have understood it nicely. I am happy. Very nice. Or a plantar flexion, I should keep a big ruler to hit you, okay? See, this is the disadvantage of this online training. Otherwise, so you can hit a person. Right? He'll always remember for the rest of his life. Okay, okay. Don't worry. So that is Peronis tertius. By the way, tertius means what is tertius? What is tertius? Meaning of Tertius, tertius. Okay, tertius is what? Meaning of word tertius. Exactly. It is third. Very good. Third. Right? Nice. So that is Peroneus tertius. So thus we have completed this anterior compartment. Chalo, by the way, if you have completed this, so why we said that this is so musical when we talk about posterior compartment. This is anterior compartment. So in posterior compartment, let's change the color, right? Which muscles would be there, right? Tibialis anterior here, so here is tibialis posterior. Extensor hallucis longus, so here is flexor hallucis longus, right? If there is extensor digitorum longus, so how musical? Flexor digitorum longus. This fourth one, what is the name of this muscle, right? It is starting with P. Well, it is right. You are right. It is popliteus, right? So that's the reason we said that it is so musical, right? Let's draw some musical notes, right? Good. Okay. So why we watch this? Just for one reason. Here it is. This part. It is anterior tibial artery. Now we know this anterior tibial artery very well, right? This is the anterior tibial artery which was like on the posterior part, and then it perforated that interosseous membrane and it comes, that's right, it came into the anterior aspect. Okay. Like we removed one structure, and that is retinaculum, right? We removed retinaculum, extensor retinaculum, so that we can see the structures nicely. So here it is, the anterior tibial artery. Sorry, anterior tibial artery, and this is, as we said, extensor hallucis longus, right? Now this extensor, this anterior tibial artery, see here, I'm just picking up on different colors so that you can see it clearly. Here it is, it goes underneath extensor hallucis longus. So I'm using dotted line, and it comes out and it goes here and it goes like this, right? This one, they are all tarsal branches, right? They are tarsal branches, and that's Dorsalis pedis. Now we'll call this as Dorsalis pedis. artery. Right? Chalo. I'm so tempted to ask you few questions. Okay. So if you say this is no doubt about it, it is extensor digitorum longus. There is one muscle, right? I am highlighting it because we have got so much of time. So let's, this one, right? This one. Sorry, I draw it again, right? This one, this one, this one, this one, and it is going like this. This is tendon of, it is tendon of, should I help you? No, I don't think so. You are smart enough. You know it. By the way, this is extensor hallucis longus. Oh, it has already been written. Again, I'm writing. Maybe it's a hint. Hmm. Extensor retinaculum? No, 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 no. It is tendon of, tendon of okay. Let's, that's right. That's right. You don't have to doubt on you. Extensor hallucis brevis. That's right. Good. Let's see with more clarity, right? Now you will be able to see it very clearly. See, right? Because over there, it was not properly exposed. So I just attempted to ask you. Now it is seen very clearly. So this is like, no doubt, extensor hallucis longus. Now you can see this is extensor hallucis brevis, right? This one is extensor digitorum longus. And here is very nicely seen the dorsalis pedis, right? Why Microsoft keeps on giving updates, right? It should not give at this point. Okay. It's buffering? Really? Uh, it's buffering? Can anyone help in that? Is it buffering to everyone? Because now we are about to see some important structures. Is it buffering? Can anyone just confirm? Can you see me okay? Continue. It's fine. All right. All right. Fine. Yeah, Priti, that's right. It's brevis. Okay. So that is the dorsalis pedis. Fine. So I'm continuing. So dorsalis pedis artery, right? We can just watch it over here, right? That's fine. Now it gives one branch, right? And that's its first branch. Right? It's the first branch, and that is the dorsal metatarsal artery. In fact, first, right? First dorsal metatarsal artery. Now there'll be one more branch, right? Which will be diving deep and then will go all the way and it will join, right? It will join lateral plantar artery. So that's what it joins. It dives deep and joins lateral plantar artery. Now we want to see what happens to that posterior TBL, right? So we talked about it, that it is the posterior TBL artery which divides into two parts, right? Medial and lateral plantar artery. So let's see them. This medial one is small, right? Meantime, we are watching, say this one is flexor retinaculum, right? Because we are about to cut that flexor retinaculum, we are about to cut that for a better exposure. Okay. Yes, this is better. Not only this, say we have cut some flexor retinaculum, we have even cut the abductor hallucis also, because that muscle, the lateral moves. So even the abductor hallucis has been cut, the medialmost muscle, and the plantar aponeurosis, so that we can see the structures clearly. So here it is. See, I highlighted. Here it is. This one is posterior TBL, right? This is posterior TBL artery, right? And it divides. Here it is. See, it goes like this and goes like this. It divides. This is lateral plantar artery, and this one is medial plantar artery. Fine. Yes, seen with much better clarity, right? Say, just for the orientation, we are dealing with the medial side, right? Just for the orientation. So we said that this is the medial side, right? So we have got over here, right? This one, that would be, say, flexor digitorum longus, right? See over here, right? This one is flexor hallucis longus. And these flexor digitorum longus and flexor hallucis longus, right? They were fighting and then they crossed each other, right? So here, can you see, I'm just removing this part so that I really want you to see that what really happens to that artery. See, it is because it is seen very nicely. So I'll write just like this, right? Flexor hallucis longus. See, that's the artery, right? See how it crosses. How it crosses. See, here it is, here it is, here it is, and it is going. It is actually, it crosses two long toe flexors and it passes in between, right? That's how it passes in between. This is medial plantar, right? We are dealing with the medial plantar artery. So I'll just put a star, right, that it crosses between flexor hallucis longus and flexor digitorum longus. Stylishly, if you want to say, so you can say that this medial plantar artery, it crosses between two long toe flexors, right? How nice it looks like, right? Otherwise, it is nothing but between flexor hallucis longus and flexor digitorum longus, right? But when you say it like, say it crosses two long flexors, right? It looks a bit royal of toe. Now, meantime, here it is. This one is lateral plantar. See this one, right? It is lateral plantar artery. And this lateral plantar artery, it will go deep, right? So here it is going like this, right? And meantime, say over here, these are the vessels which will be supplied. It supplies those muscles and the skin which is under big toe, right? And skin under big toe. Medial plantar, sure. I'll say here it is. This one, this one. Right? Can you see it? or this color. Yeah, this is better color, this one, right? Now I remove it because otherwise if I'll save it, so it will be saved with this color and you won't be able to actually appreciate how the artery looks like, because this is a very good dissection, see, right? I'll remove even those few arrows. I'll just draw them very lightly over here so that you can see. I just zoom it. Now can you appreciate? See, this is the vessel which we are talking about, right? Okay, let's go further. Now here is the lateral plantar, right? That's the lateral plantar artery. This lateral plantar artery over here, right? It gives a branch. See, while discussing, when we were talking about that all the entire structure, right? We never entered into this detail because in any case we were to cover it over here, right? So this lateral plantar artery, it gives a calcaneal branch, right? This one is calcaneal branch. Now in anatomy, you can always bluff. It's like whatever the structure which is nearest, a branch which is going towards that bone, you give the name of that bone and you are almost always right, because nearest one always supplies, right? So that is how it goes. And this branch, right, see here it goes, right, and it passes downward, right? It passes downward. Now over here, there is one interesting muscle. That muscle whose heart is very big, right? And he is flexor accessorius, right? Because he assists, right? He assists. And you know where the flexor accessorius actually lands, right? What is its another name? All these questions, right? You must know, because all these are questions of exam, that from where it will emerge, what is the shape of flexor accessorius, right? Then what is the function of flexor accessorius, and where is the insertion of flexor accessorius, right? All those. Can you identify this muscle? Can you identify this muscle? This one, right? This one, this artery is lateral plantar, right? It is lateral plantar artery, right? As it reaches to the base of fifth metatarsal. Yes, quadratus planti, right? That's right. It is quadratus planti, or its another name is flexor accessorius, right? So we'll say quad plantae or flexor accessorius, right? It gives so much of pleasure when you give correct answer, really. So here it is. Very nice. So this is lateral plantar artery. It reaches, right? It reaches base of fifth metatarsal, right? So let's write MT5, fifth metatarsal. Becomes easy. And then from here it dives deep, right? Right? And it passes deep. And then it joins, right? Joins Dorsalis pedis. That's the thing, right? By the way, you know these muscles, right? You know these muscles. Say, if I say these are flexor digitorum longus, right? Flexor digitorum longus. What was the name of those muscles whose shape is like worms. What was name of those muscles whose shape was like worms? Worm-like muscles. Worm-like muscles. And these muscles, they are emerging from someone's tendon. Lumbricals. That's right. They are lumbricals. Good, good. Very good. Okay. So this was about the arteries. Now we talk about the nerves. Very good. Now we talk about the nerves. Orientation, lateral side. We are on the lateral side. On the lateral side, we have got this superficial peroneal nerve, right? Branch of common peroneal. So this is superficial peroneal, superficial peroneal nerve. This will give, right? This is just a zoomed picture, right? We watch it closely, and this is, say, superficial peroneal nerve. And what it does, it gives sensations, right? It gives sensations to dorsum of foot, right? Dorsum of foot. How much? Lateral 3.5. As such, over here only I said this is lateral side, right? So this is lateral side, and it gives sensation to lateral 3.5 digits, right? So little finger, then one more, and the first one's half, right? Yeah. This is front, right? You have already guessed, you must have guessed it. This is front of foot. All those big giants, right? In fact, we have seen this figure. So that's like Dorsalis pedis, right? We saw that, right? That's the Dorsalis pedis, which divides. So we'll pick up the structure which we already know. This is Dorsalis pedis, right? So now say here it is, then it divides into the tarsal branch, and then it continues further, and then it gives another branch, right? That's on top of it. On top of it, it is in close association with this deep peroneal. So here is the deep peroneal, right? That's the deep peroneal, this one. So here it is, deep peroneal nerve. Now this deep peroneal nerve is super interesting. It gives extensor digitorum longus, extensor hallucis longus, extensor digitorum brevis, and extensor hallucis brevis. Quite easy, quite musical. Plus, right, those tibial is anterior and the tibial is posterior. Good. So in case if this is injured, right, if this anything happens to this, it will lead to what's called as foot drop. Foot drop. Make sense? Because all those muscles which are in front, right, when they are, say, unable to perform their action, right, they just can't extend. Yes, it will lead to foot drop because the muscles which are on the opposite side, they will be working very powerfully, right? So that's how it really goes. Here it is. This is this one, right? This one. This is quite a zoom picture, so that's why I'll just highlight it. Here it is, here it is, here it is, and then it divides, right? It divides. So this one is medial plantar nerve. Oh. This is medial plantar nerve, right? So medial plantar nerve will be supplying whom? Flexor digitorum brevis, because nearest, right? Abductor, right? Abductor hallucis and flexor hallucis brevis, right? All of them small, near, so they are by this medial plantar. Hmm. This is like another view, right? See how nicely you can watch it. The entire medial plantar now, here it is, here it is, here it is, and then it divides and it divides, right? Right here, right? That's how it divides. So this one is medial plantar nerve, right? That's medial plantar nerve, and it divides into, all these are given some name. They are common plantar digital nerves, and then they once again split to those plantar digital nerves, right? So you can see this thing. So let me name it. This is common, right? Plantar digital nerves, and then they divide. Here it is, right? They divide and they divide, and they are called as the, so they divide into two, right? So we have got two plantar digital nerves, and this medial plantar will be supplying the sole, right? So I'll write it over here, right? It supplies sole. The medial 3.5, right? Okay, so that was medial plantar. Now we see the lateral plantar. Here it is, right? And just for that, remembering that, see, this is the lateral plantar nerve, artery, right? This one is lateral plantar artery. So this one is lateral plantar nerve. Now from in this, we, to see the things with more clarity, right? See here, as it is going on the lateral side, right? It is going on the lateral side. So this is like lateral plantar nerve, right? And this will be giving supply to flexor accessorius, right? It will be giving supply to abductor, right? Abductor digiti minimi, right? And then there will be, see, that's how it is going, right? It is going all the way. And this small branch, right? That small branch, that is the superficial branch, right? It is the superficial branch. This will be supplying that flexor digiti minimi, right? Flexor digiti minimi, which was also called as flexor digiti minimi brevis, right? So brevis. And what it does, we talked about the medial 3.5. So this is what supplies the lateral 1.5 of sole, right? Because we are watching sole. So this is lateral 1.5. And what you are watching over here, that is the deep branch, right? So that is the deep branch. So watch it like this, that it is this lateral plantar over here, right? It divides. This is the deep branch, that's the superficial branch, and that's how it goes. This deep branch, right? it will give supply to all interossei, right? All interosseous. How many interossei were there? Right, 4 plus 3, right? Plus adductor hallucis, right? So that's how it will supply. Okay, as we said that we'll be talking about those two nerves. This is on the lateral side, and here we are talking about a nerve called sural nerve, right? Where it is. Interestingly, this nerve is formed by, right, combination of two nerves. See here, it is one, and here it is two. But where is sural? Sural is here. That's the sural. Sural nerve is, let's see the color. Sural nerve is the combination, right? One branch of tibial nerve, second branch of common peroneal, right? So I'll just write tibial nerve branch. What is name of that branch? Very easy. It is the medial sural cutaneous nerve. So that's the name. And what about this another one? This is branch of common peroneal, right? Common peroneal. So what name? Common peroneal nerve. What name? Well, it will be talking to sural nerve. So let's give the name sural communicating. Sural communicating. To avoid the confusion, let's highlight only the names so that when you see, it should be easier, right? So you can say sural is the combination of medial sural cutaneous nerve branch of tibial and the sural communicating branch of common peroneal. So that's the sural nerve. Where it will go? On the lateral side, right? So let's continue. On the lateral side. So lateral side ankle, right? Of ankle. That's the area it supplies, right? Just behind lateral malleolus, right? Lateral malleolus. So that is supplied by sural nerve. This is sural, right? That's the sural nerve. Yeah, it's a combination, right? Because there is a branch which is coming from that sural communicating. It is from common peroneal also, because this is basically a sensory nerve, right? It's a sensory nerve. It's a sensory nerve. So all those sensory fibers, they come over here. That's right. Now there is one more branch. There is one more nerve, and this nerve is called as the saphenous nerve, right? And it is this. So it is saphenous nerve, right? This one is sartorius, right? So when we see sartorius, so that gives the idea that which side we are talking about. True? Okay. And this is knee, right? So we are at knee, and sartorius is landing on the medial aspect, right? Okay. So this is saphenous nerve, and this saphenous is branch of femoral, right? It is branch of femoral nerve. So what it will do? What sural was doing on the lateral side, saphenous will be doing on the medial side, right? So here is the saphenous nerve, and this we are dealing with the medial side, right? This is the medial side of leg, that's medial malleolus, and it supplies this area, right? That's the area, that's the medial portion which is supplied by, so that is by saph, right? Saphenous nerve. One more thing, as we are on the verge of completion of this topic, this area, that's heel, right? This heel is supplied by that calcaneal branch. You remember that calcaneal branch, right? That's what it comes over here, calcaneal branch of tibial nerve. So it supplies, right? It supplies it over there. In the last session's PDF, all Mukesh, what you are talking about, it has already been done. So if you look at that PDF, you'll get your answer, right? Okay. Okay. So now this is just skin of the foot, and this skin, right? The skin, it is, say, on the dorsal side, this is thin and mobile, right? That is on the dorsal side. On the plantar side, well, on the plantar side, we know that this skin is thick, right? But there is something which is interesting. This is what is in the foot. In the foot, there is a strong padding, right? Because of that fat, there is a strong padding. And the best part is that this entire fat, right? This fat, right? This fat is divided into septa. See, these are the septas, right? This is divided into several septas. Septa. So thus everything is kept into separate compartments, right? So, right, say here these are some of the septas which we can see. Now here is a closer look at this septa, right? So that's the septa. All right, so that's it for today, and thank you so much, and wish you all the best for the grand exam for tomorrow, right? And tomorrow we'll keep a combination. We'll be keeping some of the images, we'll be keeping some of the questions, few of the MCQs, and in some cases absolutely fill in the blank, right? It would be a sort of a mixed bag. All right. Yes, veins, they are all same. They are all same. As we discussed previously also, padding means it's a fat padding, fat, layer of fat. And as we discussed that it is the short saphenous and the long saphenous vein, only they are different. Otherwise, rest of the veins, they all are similar. And finally, they'll be meeting that inferior vena cava, and they'll be going all the way into the right atrium, right? Marks, I think, why to worry for the marks? But well, we'll be keeping 30 questions, right? 30 questions, so 30 marks, right? 30 questions. Okay, thank you. And I just save this thing and I'll be putting it into our shared folder. All right, thanks a lot. Wish you all the best. And we meet tomorrow. Okay, bye-bye.